In the name of Allah, who is the most merciful and the most beneficent. Assalamu alaikum. My name is Tahseen Mubin. My roll number is EP1770044. My group number is 2. And the topic assigned to our group is traumatic skin and soft tissues infection. And today I am going to elaborate a subtopic for it, that is cellulitis. As the suffix of this name indicates, it is an infectious condition which can be defined as an acute spreading bacterial infection below the surface of the skin characterized by the redness. In biological term, we call it erythema. Warmth, swelling, and pain. Cellulitis occurs when an entry point through normal skin barriers allow bacteria to enter and release their toxin in the subcutaneous tissues. So the point is, our skin is the strongest barrier for our body against the bacteria, and when there is any kind of ruptures present in our skin, the bacteria got a chance to enter in our body and release their toxin to create harmful effects. A pictorial representation is here where we can compare the normal and the infectious condition of the legs. Whenever there is an cellulitis condition, the patient consults to a doctor. A clinician may mark the edge of the red area to monitor whether the infection is getting better or worse. It starts with the redness and swelling majorly, and it follows up with the abscess and blisters formation. Now moving forward, we can see the etiology of cellulitis. It is basically the break in the skin from an abrasion or cut or a skin ulcer. Local trauma such as animal bite. Bacteremic spread of infection, which can be defined as bacteria arriving from a distant source via the bloodstream. Staphylococcus aureus and Streptococcus are the usual causative agents, and most of the Staphylococcus family are involved in this cellulitis. Pathophysiology of cellulitis is break in the skin, as we have seen before, such as fissure, cut, laceration, insect bite, or a puncture wound causes entry of bacteria into the subcutaneous tissue. Deep inflammation of the subcutaneous tissue from enzyme produced by the bacteria. Not only on the skin, but the cellulitis condition can also affect our vital organs such as eye. It could be caused around our eye and cause severe pain, and there is a pus formation, as you can see on the picture. It produces intense pain and swollen skin around the eye, and we used to treat it properly before any severe complication occurs related to the eye. Now, signs and symptoms: fever, chills, erythema, swelling with local tenderness and pain, malaise. Regional lymph nodes may also be tender, and enlarged lymphadenopathy. Moving towards the complications of cellulitis, it is basically a treatable condition, but antibiotic treatment is necessary to eradicate the infection and avoid complications and spread of the infection. Most cellulitis can be effectively treated with oral antibiotics at home. Sometimes hospitalization and intravenous antibiotics are required if oral antibiotics are not effective. Sepsis is a serious complication of cellulitis if not properly treated. Cellulitis can occasionally spread to the bloodstream and causes serious bacterial infection of the bloodstream that spreads throughout the body. That is, the condition is known as sepsis. Now, moving towards the management, mild cases of cellulitis can be treated on an outpatient basis with oral antibiotic therapy with diclofenac, amoxicillin, clindamycin, and cefalexin. If the cellulitis is severe, the patient is hospitalized and treated with an intravenous antibiotic for at least 7 to 14 days. Immobilize the part and elevate the extremity above the level of heart. Provide moist heat to promote wound healing. Now, the preventions are very common and can easily be adopted. Under some circumstances, cellulitis can be prevented by proper hygiene, treating chronic swelling of tissues, edema, care of wounds or cuts. In other cases, microscopic breaks in the skin may not be apparent and infection may develop. In general, cellulitis is a healthy person with an intact immune system. Is preventable by avoiding skin surface wounds. In people with predisposing conditions or weakened immune systems, cellulitis may not always be preventable. I hope you guys can understand the concept of cellulitis. So that's all from my side. Thank you so much.